Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to prepare for the CPC exam after you have completed your medical billing and coding program or your self-study program. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so it's that time. You have completed your medical billing and coding program and you're wondering how long should it take to study? And I will say this before I get into the whole episode. Everybody's readiness is going to be different. There's going to be some people who get into school who really love school, okay? And who have always loved school. So it's going to be a little bit easier because they know how to study. They've been, really on it, on their studies and been practicing and things. So they're going to be a lot more ready than the person who is kind of lost, maybe didn't enjoy school, or maybe enjoyed school at one time, but for some reason, they just don't understand this medical billing and coding. And so it's a little bit more harder for them and they're struggling. So either way, either boat you're in, take my advice, don't take my advice, it's entirely up to you. But my advice is just going to be put out there because I am a veteran medical coder. I've been a medical coding student for 16 years. I have been a certified medical coder for 15 years. And so with that said, I love to study. And I think that adults learn differently from children. And I think as adults, we have to learn that because when was the last time we were studying as children, right? So that's what we sort of know. So we think that cramming is okay. And we think that, trying to do things really quickly and shortcuts, that's the way to go. That's not the way to go because as adults, we have our adult brain and adult brain is a lot different from child brain. When you're a child or even an adolescent, you have no worries as far as like mortgage and car payment and bills and, trying to keep food on the table. You don't have that additional worry like a child does, okay? Or a child doesn't have that additional worry like an adult does, okay? That's what I meant. The other way. But with that said, you have to take it easy on yourself. And the advice I give today is meant to set you up for success. And I say that if you feel like you're unsure, then take 90 days from the time that you complete your program. And sometimes people are on a clock, so they have like a set date that they have to take the test by. And so, use this talk today to kind of help you to gauge where you are and where you should be. So here we go. So the thing about it is, if you have gotten through the whole program, you already know, or even if you've done self-study, you already know where your weaknesses are, okay? It's not a secret what is on the CPC or the Certified Professional Coder exam, and that is a medical coding outpatient medical coding certification with the American Academy of Professional Coders. I will also say this, I am not affiliated with AAPC. I've never been certified with them. I will never be certified with them, but I am a medical coder who does my research. So I know plenty, and I'm not this East Coast, West Coast type of person that doesn't believe in sharing, what's out there and what's good for medical coders, because the medical coders come from two organizations, the American Health Information Management Association, which is where I belong and who I'm certified through, and the American Academy of Professional Coders. So you can be certified through either one. And to me, I look at everybody. I don't look at, I only look at HEMA or I only look at APC. That's stupid. It's stupid and immature. I look at the person's intelligence. That's what I look at. Okay, so with that said, when you're preparing for the CPC exam, just know that you should be studying however long you think that you need to study. But if you are unsure and you're still kind of like, I don't know, Blue, 90 days. Just go with 90 days first, okay? Try not to go any further than that, because if you go any further than that, you run the risk of forgetting all the things that you learned in the school. Even if you had bad teaching in the school or if you had good teaching in the school, you're going to forget a lot of those things the longer you get away from graduation and you haven't taken your test yet. I've seen people fall into this trap of, I'm just going to study for 6 months and then I'll be ready. 6 months comes and goes. Hey, give me another 2 months. 2 months comes and goes, and that's 8 months. I'll take it next year. A year goes by. You don't want to be that person, guys. Please don't, because you put too much money and time into this to learn it. So give yourself the opportunity to take the exam, okay? But set up a study schedule. Get yourself a date. If it's going to go 90 days, okay? 90 days from date of graduation, and then you're going to be taking your exam. Okay, perfect. So now you've got a target date. You have to have a target date. If you do not have a target date, you're basically going to mess around and you're going to find out, okay? Give yourself a date, because mentally you need to have a date to be looking at, like, that's the date we got to go. That's the date we got to go take this test, whether we feel ready for it or not. Because a lot of times you don't give yourself enough credit, right? You know? So again, give yourself a date, 90 days from the date of graduation. And now you're going to set up a study schedule. This study schedule has to be 20 hours per week. There are no excuses. I don't want to hear people emailing me or commenting, I work 40 hours, I have kids, and I have this. There's lots of people who work not just 40 hours, they work 2 jobs. They still manage to squirrel in time to study. They still have a house full of kids, animals, and goats, and horses, and all kinds of things. So they're able to do that and still make the time. You can make the time. You just have to stop making excuses, because there's going to be people who will make excuses. Oh, well, I made excuses and I don't know why I failed. How many hours per week did you study? Well, honestly, every time I hear, well, honestly, I know I'm about to hear a lie. And then they tell me 5 hours. That is not good enough. And that is why you failed, because you only studied for 5 hours. In a month's time, only 20 hours really that you spent to put towards your studies. That's it? That's really it? Just those 20 hours, that's it? Well, I didn't have time. You do have time. 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon. And then you do your things here and there, cook, clean, do whatever you got to do, drive the kids here and there, whatever. 1 hour and then 1 hour. You could be working on your workbook. You could be listening to videos about medical terminology, HIPAA, all those. And I don't have to leave the links, guys. I don't, because that's a simple YouTube search, okay? You can even put it into Google. You can put it into Google. You can listen to the guidelines. I have explained so many times how to listen to the guidelines. I am not explaining it again. But you can listen to the guidelines, or you can read them. Reading the guidelines in their entirety once per week is going to make you a faster reader. Because what I hear from a lot of people is, well, Blue, I'm a nervous test taker. No. You're too busy thinking about other things that you don't need to be thinking about. Like, people are distracting me and I can't listen, I can't pay attention. No. It's because you weren't studying enough. Let's be honest, because I'm not here to mollycoddle anybody, okay? I am here to get you to look at the reality of the situation. How much time are you spending studying? If it's not 20 hours per week, it's not enough, okay? 20 hours is all you need. You don't need to be giving yourself all these long hours per day and stressing yourself out, because guess what? Your brain is going to fight back and be like, no, we're not doing this no more. We're not studying, and we're just going to do whatever. So if you give yourself just enough, 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon, 1 hour and then 1 hour, that's 3.5 hours in one day. 3.5 hours in one day. You do that for 5 days a week. I know you got the time. If you got time for TikTok, you got time for LinkedIn and Facebook and all these things, you have time to study, listen, or read. That's 17.5 hours in 5 days. And then you have 2.5 hours on the weekend. And that's it. And then you're done. Easy as pie, right? Easy as pie. Or you could always do 4 hours, but not all in one sitting. You have to stop after 1 hour. Listen to me when I say this. Stop studying after 1 hour. Take you a break and then come back to it. 10-15 minutes. That's all you need. Because if you go past an hour, you will get fatigued. And as somebody who studies a lot, I know that. I have experienced it firsthand when I was taking my, get ready to take my CCDS exam. The second that I went past 1 hour of study, I started to feel fatigue. And then I couldn't understand why I was getting so many of the questions wrong. And then if you start getting a lot of questions wrong, then you start feeling like, man, am I ever going to get this? So don't set yourself up for failure. Set yourself up for success. Give yourself those breaks. Give yourself the proper nutrition you need. And by proper nutrition, I mean drinking water, not getting all hopped up on energy drinks or coffee or tea, even though I love coffee. But you need to make sure that you are staying hydrated and that you're getting the proper nutrition and things, so that way your brain can focus, and you're able to absorb this information that you're trying to learn. All right. So in this time that you're going to be studying for these 3 months, right, and you're getting those 20 hours in per week, you're going to start isolating where you need to work. Where is it that you're really struggling? And we're going to go over the 100 question breakdown right now, because it's on the AAPC website. And how some people still write to me, Bleu, I'm so confused. I don't know what to study for the AAPC CPC exam. It's there on the website. You can even Google the AAPC CPC exam outline, and this will pop right up. It's that easy. It is that easy. So a breakdown of the 100 question exam for the CPC. Passing the CPC exam requires you to correctly answer a minimum of 70 questions. This means that out of 100 questions, you only need to get 70 correct, right? You can still miss 30 and still pass it. So why some of you still panic and you still say, oh, Bleu, no, I'm scared. That's a pretty big gap for you to be able to fall, okay? So relax. You don't have to get 100% of the questions right. It helps, but you don't have to get 100% of them right. So that's what I'm going to get into here in a minute. From the domains below, the CPC test will rely on a level of understanding that enables you to identify the domain, right? Because these are going to be all mixed up. These are not like, oh, here's your medical terminology questions, here's your anatomy questions. They're going to be all mixed up through this test. That's what they're saying. So medical terminology is 4 questions. There's going to be 4 questions specifically to medical terminology, all right? These questions will assess your knowledge of medical terminology for all systems of the human body. If you are working on learning your prefixes, your suffixes, and your root words, this is not going to be an issue for you. Why? Because if you can learn to piece words together, then it's going to be so much easier for you to understand a lot of different words, okay? Just saying. Anatomy is 4 questions. These questions will assess your knowledge of anatomy for all systems in the human body. If you're looking through your book and you're not cluttering your book with all this stupid writing, because it doesn't need to be written in, guys. It doesn't. All these notes that y'all think that are so helpful, and please save your comment if you do, because, oh, yes, it helped me. No, I think some of you comment those things because you want to say the opposite of what I'm saying. But here's the thing, guys. If you're using your books like you're supposed to, you don't need all those notes. If you have your choice of publisher when it comes to the ICD-10-CM manual and the HCPCS manual. The only one that everybody has to have the same one of is a CPT AMA Professional Edition. That's the one we all have to have. But when it comes to the ICD-10-CM book and the HCPCS book, it is your choice. This is not an ad, but I recommend the Optum books for those. So the Optum, the ICD-10-CM Expert for Physicians is the one that I recommend. There's somebody out there who's saying, oh, no, that's not a good book. Rah, rah, rah. Okay, you clearly don't know, okay? And, oh, use the one Expert for Hospitals. I've looked at the Expert for Hospitals, and y'all know I love Optum. But something about that book, I don't like the way it's set up. Me personally, I do not like the way that book is set up. Now, again, it's your choice. It's entirely up to you. But what I'm saying is, you don't have to have all these notes. You don't have to have tabs and all these highlights. Why? Because if you're using the book like you're supposed to, those tabs are going to get in your way. Okay? And you would know that in your books, they do have anatomy plates. So while you're panicking because you can't memorize everything, it's already in the book. If you look in your appendixes. Okay? So then you have three questions on compliance and regulatory. This section will test your knowledge of compliance and regulations, which pertains to services covered under Medicare Parts A, B, C, and D. You have to know what all those 4 are. And then applying coding to payment policy, place of service reporting. Again, stuff that you need to know, and place of service. They have a whole list of them in the CPT manual. I'm just saying. The fraud and abuse, NCCI edits, NCDs, LCDs, HIPAA, ABNs, and RVUs. You have to understand what all of those are. And that's a very small amount of questions. There's only 3 of those questions, guys. Come on. Coding guidelines, 7 questions. Now, if you're reading your coding guidelines, you're going to be able to breeze right through these because, again, you get to take the guidelines in there with you. You can, and if you've been reading them over and over again, because they're not going to make sense. But if you're reading them over and over again, well, guess what? You're going to remember where to go because something's going to spark your memory. And you're going to be like, I remember I saw that somewhere. But if you're not reading your guidelines, then you're going to be like, oh my God, what do I do? Come on, people. Come on. And it says this section will address the ICD-10-CM official guidelines for coding and reporting, CPT coding guidelines, and parenthetical notes and modifier use. Again, if you're looking at the CPT manual, you'll know to look in the back in the appendixes because that's where all the explanations of all the modifiers are. The inside cover also has a list of all the modifiers. And at the beginning of those sections, like the surgery section for the E&M section, there's all the rules and everything listed right there. It cannot be any more easier than this. It can't. ICD-10-CM, specifically, 5 questions. This area will test your proficiency in diagnosis coding within all the chapters of ICD-10-CM, as well as thorough knowledge of the ICD-10-CM official coding guidelines, guidelines for coding and reporting. What did I tell you? What did I tell you? Additionally, diagnosis questions will appear in other sections of the exam from the CPT categories. HCPCS level 2 is 3 questions. And so many people write me panicking about the HCPCS. I'm like, why are you panicking? It's such a small portion of this test. Why are you panicking? And it is so easy to understand. Because if you have learned how to look up a diagnosis code, if you have learned how to look up a CPT procedure code, trust me, all you have to do is review the book for the HCPCS and you'll see what's in there. You can look at the index and see all of the items and all the services that are included in the HCPCS manual. And that's just as good as studying the HCPCS manual because you'll know where to find the code, okay? But this section will test your knowledge on HCPCS level 2 coding and includes questions focusing on modifiers, supplies, medications, and professional services for Medicare patients. So think about the colonoscopies, right? Colonoscopies use the G code. You have your regular screening and you have your high risk, okay? Okay. Now CPT, right? The 10,000 series is 6 questions. Now here we're getting into the heavy side of the exam, right? 6 questions for the 10,000 series. So this is going to go over the integumentary system, which includes the skin, subcutaneous, and accessories, accessory structures, as well as nails, cysts, repairs, and destruction. And then the 20,000 series, this is the musculoskeletal system from head to toe. 6 questions. And then the 30,000 series, 6 questions. That's the respiratory and cardiovascular system, the hemic and lymphatic systems, and the mediastinum and the diaphragm. The 40,000 series is 6 questions. That's the digestive system. 50,000 series is 6 questions, and that is for the urinary system. And then we have our 60,000 series codes, which is for the nervous system. The radiology is 6 questions. Pathology and laboratory is also 6 questions. The medicine section that covers a lot. It is sort of the catch-all of the CPT manual, and that is 6 questions. E&M is 6 questions. Anesthesia is 4 questions, and the cases, it is 10 questions, 10 cases, 1 question each. Wow. Okay, well, 10 cases, 1 question each. So each case will test your ability to accurately code medical record documentation using CPT, ICD-10-CM, and HCPCS level 2 codes. Okay, so it's going to ask you 1 question for each of those 10 cases. That's what it says, 1 question each, according to this here. So I think they're doing the fill in the blank. I haven't heard anybody say anything to me about how it went or anything like that, because I know it was supposed to be like that. But here's the thing, guys, if you are practicing, and not just when you have the CPC study guide, right? Which you guys know I love that book, because I feel like AAPC got that right. That is a really good book. There are very few codes in that book, and the answer key that I disagree with. Very few. And it's just a matter of just a little bit more detail. That's all. But if you are covering up the answers and not looking at the multiple choices, and you're deciding the answers yourself, and you're looking up these codes yourself, that is going to prepare you a lot more than you sitting here trying to figure out how to do process of elimination, which is garbage. Process of elimination is only when you absolutely do not know. That is not supposed to carry you throughout the whole exam. If you are practicing with the CPC study guide like you're supposed to, and covering up the answers and looking up the codes yourself, you're going to be a lot more prepared than the person who's looking to do those cut corners and, oh, I don't know this, so I'm going to try to pass this test so I can hurry up and get a job. Well, guess what, guys? If you're barely passing that test, you get out in the real world, they're going to assess you again. They're going to give you a test, and they're going to say, okay, if you can't pass this test, we're not going to hire you. So be prepared. Cover up those answers. You can, if you want to do more scenarios and things like that, the ICD-10-CM and ICD-10-PCS coding handbook with the answers by Nellie Leon Chisholm. That link is in the description box below. No, I will not answer that question because it is in the description box below. And in that book, you can skip the ICD-10-PCS questions. ICD-10-PCS is for inpatient procedures, right? With the ICD-10-PCS book, you don't need to know ICD-10-PCS for the CPC exam. So just go over the ICD-10-CM questions. That's the diagnosis questions. And in the back, they have so many scenarios where you can work through and cover up the answers and work through and get the diagnosis codes. So that will also help you. You'll be faster at looking up the codes, okay? Because remember, guys, you have to use the book when you're in that exam room. So you have to get the practice time in. The bulk of this test is your coding knowledge and your skills, right? Looking up those codes. So make sure that you are spending time with your book, so that way you can be comfortable with your book. You can be very familiar with your book, all right? Because again, you don't need to be putting all these tabs and highlights and writing, and so much writing where you can't even see what's on the page. The book is written by doctors and scholars. It doesn't need you to add anything to it. There's nothing that you can add that can make that book better, okay? All you're doing is just writing all over it. When it's not a workbook, and you could be working in a workbook and writing all over it, okay? Or taking your notes and then, looking at your book later while you're studying. So do it that way, guys. And if you cover up those answers and you work without looking at the multiple choice, that's going to help you so much. Go to Quizlet and go review those CPC exam questions. Now, remember, some of those questions are going to be incorrect or the answers are going to be incorrect because they're written by people, and sometimes they're very tired, I guess, when they're doing these questions, whatever. But these are people just making up things too sometimes. So that's the thing you have to keep in mind. Make sure the answers you're studying are correct. So go through those and practice, practice, practice. The more practice that you can get, the better off you will be. And I will say this in closing. I do have my Patreon channel. My Patreon channel has hundreds of 10 question coding quizzes, and they have all kinds of quizzes. And I also have the crossword puzzles and the word searches and things. I do have the once a month live study hall on Zoom that I have. But I say this to say that if you want to join, that is going to be the only interaction I'm going to have until the fall, because right now my calendar is closed for private tutoring or professional coaching or resumes. I am completely booked solid. I got nothing. So I won't be opening my calendar again until September. But if you still want that one-on-one time, it won't be personal, but you can certainly join Patreon and attend the once a month live study hall. It is $10 to join. That is a minimum pledge. for Patreon. So if you're interested, the link for my Patreon channel is in the description box below. And so, but that's what I have that's the best I could do for right now. So, but anyway, with that said, best of luck to you. You can do this. If people would focus more on studying and practicing rather than how they feel and what they think and how scared they are and listening to other people who know nothing about our industry, they would feel a lot better and a lot more confident going into those tests than being all worried. Worry is unnecessary when you can be prepared. And I'm telling you how to be prepared. So prepare yourself. Know that you're going to do a good job. Even if you didn't have a good teacher, it's okay. You can still learn on your own. We can learn medical coding on our own. It is just going to take a lot of practice, okay? At least that's my advice anyway. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.